Hello, I'm Dr. Carmen. Welcome to the Sleep Lab. Thank you for coming to visit with us today. When you arrive, please sign in at the front desk and let them know if this is your first visit or whether you're returning. If you've been here before, we certainly want to identify your records, get them reviewed with you while you're here, and give you the best recommendation of treatment and care. If you've not been here before, there'll be a pre-evaluation questionnaire to fill out to help make sure we understand about your past medical history, past surgical history, medications, and other medical problems that may influence your sleep and sleep disorders. Here at the Sleep Lab, we talk about a variety of different sleep problems, the most common of which is not getting enough sleep. With this, we have specific counseling that we can give you and recommendations. Another sleep disorder is really getting enough sleep but bad quality sleep for a number of reasons. One of the most common reasons to have this is something called sleep apnea. If you've already had a sleep study, we may have been looking for sleep apnea, and we'll certainly go over the sleep study and make further recommendations. Other sleep problems include narcolepsy and circadian rhythm disorders. If you've already been treated for sleep apnea or a sleep problem, please notify the staff. If you're already on a CPAP machine for sleep apnea, please turn in your smart card download so we can have that available to review with you during this appointment. If your company has done this for you, please tell the staff so they can get it from your company so we can still review it during this appointment. Many times people are sent to the sleep lab after they've already had a sleep study. As you know, a sleep study is done when we have people asleep and we monitor many things about what's going on when they're asleep. We identify as their sleep apnea or abnormal awakenings or seizure disorders or abnormal sleep structure. We'll identify these problems and go over your sleep study with you during this appointment. If you already have sleep apnea, hopefully you're already being treated and we can identify whether that treatment is working well for you. Sleep apnea is identified as stopping breathing at night when we're asleep. Many of us have sleep apnea and we don't know. We go to sleep and we get to a deeper sleep and our jaw structure relaxes in a way that occludes our airway. Sleep apnea is worse than snoring. It's actually completely stopping breathing. We go to sleep and we're desperate to sleep. Our body lets us go to sleep till our oxygen level gets to a low enough level. Then it makes us wake up to start breathing again. Then we go back to sleep and all night it's waking and having a low oxygen level, going back to sleep, then waking again, then going back to sleep and getting a low oxygen level. So it's up and down all night, but we just think we're asleep. So the treatment of sleep apnea is 3 different things that we can do to treat sleep apnea. One is positional therapy, where we can have you just sleep on your sides or on your front, because typically sleep apnea is worse when you're at your back. But this is only for very mild sleep apnea and then only when it's on your back. Most of us have sleep apnea that happens in all positions and is more than mild. Other treatments include mandibular advancement device, which is a bite block that's made by some of the dentists that go in our mouth at night. It advances our jaw forward in a way that gives us a little bit more room in our throat so our throat doesn't close with sleep apnea. This is approved for mild sleep apnea. Other treatments include a CPAP or BiPAP machine. A CPAP machine is a mask and a machine that goes on us at night that gives us enough air pressure that inflates our throat so we don't snore and so our throat doesn't close when we're asleep. The pressure required would be as if you would take a balloon and put enough air in it that the walls of the balloon distend, but you're not going to expand the balloon. It's just enough to keep the airway open. So you can go to sleep, stay asleep, and have a normal oxygen level and a normal sleep structure, but you've got to be on your treatment all night, every night when you're asleep. Another treatment for sleep apnea can be surgical revision of our throat or head and neck. Surgeries work about half the time, and the definition of work means you still may be on a CPAP machine, but you don't need as much pressure as you did before. Most of us save surgical referrals for people when they're refractory to CPAP or can't tolerate a CPAP, or if their anatomic structure looks like they'd be an especially good candidate for surgical cure. But sleep apnea does have many other treatments that you read about on the internet, but most of them are very kind of mild treatments for mild disease, and I wouldn't really recommend those, but we can certainly talk about those. Other treatments for sleep apnea that can be done if you do have sleep apnea, we'll want to review your smart card. On the smart card is simply a download that shows us, are you using the CPAP machine at night? If so, how many hours? Is there a big leak? Is the mask okay? Are you actually using it the hours that you think? And then more specifically for me, is the pressure really right? In the CPAP machine download computer assessment, there's a way to understand whether the pressure is enough to keep your airway open. If it's not, we're going to have to readjust your pressure. It's recommended that we sit down and go over this about once a year. At that time, we can review, does the pressure need to be adjusted? Do we need to restudy? Or do we need to update your mask supplies and equipment? Or if that's not working, do we need to talk about surgical options? Now, some people can lose significant weight, and when their weight comes down, we can repeat a sleep study to see if they've lost their sleep apnea. Only about 20 to 30% of people who go from very heavy to their ideal body weight really lose enough weight to get rid of their mask and machine, but that's still something we would consider. If you have sleep apnea and you're a professional driver, we'll need to make sure that we have smart card downloads available for credentialing and to make sure that we can always prove that you're driving safely. Some of the problems we have with CPAP machines can be difficulty with pressure. If you feel that there's too much pressure, we can discuss changing to a BiPAP machine or lowering the pressure until we get used to it. Other problems have a lot to do with dryness of our nose and throat. We always want to make sure that we're using a humidifier with the CPAP and we're putting water in it every night. If we're still dry, then we should turn up our adjustment to put more water and vapor through our humidifier. If we're on the maximal setting and we're still too dry, then we can use a product called Biotene, which is a mouthwash that you can get at virtually any drugstore to use at night before you go to sleep. If you have a completely dry mouth, but you're using a nasal mask, it may be because your mouth is open all night. Perhaps we should either use a chin strap or a full face mask. If you are ever getting any facial blemishes or sores around where your CPAP machine is, we want you to call your supply company immediately and let them know you're having some cosmetic problems with your mask and the mask needs to be changed immediately. Whenever you do have specific mask issues or the mask is breaking, you want to call your supply company right away to let them know and get new equipment. You should also be getting updated mask supplies and equipment on a schedule with your supply company. Once your CPAP machine is prescribed, there's a maintenance plan, but also updated mask equipment, supplies, tubes, hoses, and filters that will be available to you on a specific time basis depending on what your insurance plan is. Once we start treatment with CPAP or BiPAP, most insurance carriers require a face-to-face appointment with a sleep specialist 31 to 90 days after you've started your CPAP machine. If that's what you're here for today, please register at the desk and make sure that we have a copy of your smart card download so we can review that face-to-face, make any adjustments that we need, but more specifically make sure we're doing a good job for you, make those adjustments, and can show that you're using it in a safe and compliant way. All right. Sleep apnea is defined as stopping breathing at night. When we go to sleep, and the deeper sleep we go into, the more lax our jaw structure is. Those of us who have a narrow airway actually get collapse of that airway when we're asleep with muscle relaxation. The term apnea means to stop breathing. This can have a very small, narrow, can have a very small range that is normal. Once it exceeds a certain range with symptoms, it can be significant enough to treat. Sleep apnea can cause other metabolic issues. It can make blood sugars worse, hypertension worse, and cholesterol worse. Untreated sleep apnea ends up with more heart attacks, strokes, and arrhythmias, and people with untreated sleep apnea don't live as long. Untreated sleep apnea has also been associated with decreased cognition and poor mood. We know that when we treat sleep apnea, we can actually give someone an IQ test with different scores both before treatment and after treatment for sleep apnea. treating sleep apnea doesn't make you smarter, but it allows your brain to get better sleep and better function the next day. Metabolic disorders associated with sleep apnea include diabetes mellitus, hypercholesterolemia, and hypertension. Every time someone has an episode of apnea at night, their body wakes them up with a shot of adrenaline. That adrenaline goes to all of your body and makes your blood pressure go up, cause insulin resistance, and interfere with cholesterol metabolism. So in addition to being awakened, it's actually causing these metabolic abnormalities that make you more prone to heart attacks and strokes. If you are well treated for your sleep apnea, your survival goes back up to the normal as if you'd never had sleep apnea. But you must find a way to get it treated and keep it treated every night. Untreated sleep apnea also causes two neuropeptide abnormalities. One is called ghrelin and the other is leptin. One of them makes you hungrier and the other one turns down your metabolism. So now when you have sleep apnea, you go to sleep, you stop breathing. A lot of it has to do with neck mass and being big in our neck and causing collapsibility. Once you have sleep apnea, you have those two neuropeptide abnormalities and they cause weight gain. And with the weight gain causes more neck mass and more sleep apnea. When we treat sleep apnea, those two neuropeptides actually go back to normal. So the metabolism boosts back up to the normal level and the appetite goes back down to a normal level. So people can finally start to lose weight when we treat their sleep apnea, but it's still going to take a plan and a lot of work. Again, thank you for coming to the Sleep Lab. Please remember to fill in the questionnaire so we'll have all the data available to review for you in a timely manner. Thank you.